Hello from PAA headquarters. I'm John Culp, Director of Insurance, and today we're going to be telling you a little bit about collapsing hospital markets and the rise of value-based care methodologies. First question that we hear a lot are, what are some of the main challenges facing healthcare purchasing today? Number one being pharmaceuticals. They're by far the fastest growing issue facing consumers and employers in today's world, as specialty drug prices are rising at an enormous pace, along with biosimilar and gene therapy drugs. However, that's a topic we're going to dive into in a future episode. A major issue that exists is the collapsing of community-based hospitals, more so the condensing of the hospital market as a whole. This could be either by acquisitions or simply closures. We're seeing an unprecedented number of hospital acquisitions and closures over the years. While some in the market lead you to believe that consolidation is a good thing, i.e. more resources, better technology, etc., the reality is that consolidation doesn't equal integration. Within this consolidation, you're seeing health systems also playing in the insurance sandbox. Second question we hear a lot, what are some of the issues that hospital consolidation presents? Well, there are several, and there's some pros too. However, the largest concern is that these hospital systems get larger and larger. They also have more flexibility in setting their price. The more leverage they have at the time of a provider contract expiration, the more negotiations fall in their favor. There is a risk-reward factor involved that a health insurance carrier has to weigh. One, do we let the provider hospital system walk because their cost is too high? Two, do we concede to their wishes and rates so that we don't lose provider access points in our network? Usually the answer often falls somewhere in the middle. The largest challenge facing healthcare insurance in general is that the service we're insuring is not decreasing in price. When the services you're insuring are constantly on the rise, your costs to insure them are also going to be on the rise. An example, look at your auto and homeowners rates since COVID. They have all increased dramatically, simply due to the fact that parts, labor, lumber, car parts, etc. have risen significantly. The market simply dictates the pricing. Another afterthought here, but it's also a reality, is that hospitals make up for very low margins or deficits in the Medicare space by increasing margins and pricing in the commercial private insurance arena. Third question, are there any answers or solutions? While medical and pharmaceutical costs are not going down, these issues have forced both providers and health insurance carriers to look at creative ways to help slow the spend. One of the main philosophies and models that we've seen rise in interest is referred to as value-based care. A lot of acronyms and models fall under this umbrella, including but not limited to accountable care arrangements, ACOs or ACAs, patient-centered medical homes, PCMHs, value-based benefits, VBBs, pay for performance, shared savings programs, etc. Without getting too far into the weeds, our government has started to invest into these models many years ago, as many providers now have to report HIDIS and STAR ratings, simply meaning there's more oversight on quality and pricing to some degree. Well, what is value-based care? Simply put, it changes the provider reimbursement model from a fee-for-service to bundled payment arrangements and shared savings reimbursements. Fee-for-service models pay for every service or procedure incurred, whereas a value-based model pays more for an entire episode of care. The intent is to pay for quality over quantity. Some offshoots have come out of this as well. Some products being offered by health insurers now have a narrow or tiered network design, whereas Tier 1 will be the least out-of-pocket for the member, Tier 2 or 3 will have more out-of-pocket expenses. These tiers have different health systems as part in each one. Consumers must be well educated though, because each health insurance carrier could have different health systems in different tiers. For example, one insurer has a better deal with one health system than another. When I say health system, that could be a UPMC, a Penn State Health, a WellSpan facility, etc. Are there any other ways consumer can help their healthcare spend? I really wish we had a miracle pill or fairy dust solution to erase the cost of healthcare, but it simply doesn't exist today. Healthcare has risen at a much higher rate of inflation over anything else in our lives for many consecutive years now. While there's not a magic pill, there are certainly ways to help lower costs or keep costs minimal. Value-based care certainly can be a solution and help with this, but it's not for everyone. Consumers need to be well educated on how those plans and networks work. Another way to help with the rising costs is to be educated on where you go to access care. For example, we shop for everything else in our lives: groceries, clothes, cars, phones, you name it. But we traditionally don't shop for healthcare. A major fault of this has lied on the backs of the industry. For the longest time, pricing was never published or available. However, healthcare was the only thing that we obtained services for, but we blindly had no idea what we were paying until a month or so after the date of service when a bill arrives in the mail. While additional legislation and consumer tools are arising, healthcare pricing is becoming more widely available for all, i.e. transparency. There is terminology in the healthcare field called site of care. It simply means that your site of care could have a significant impact on the cost of your care as well. For example, having blood drawn and tested through a hospital facility versus a freestanding facility could save you hundreds. It compounds even more when you're having an outpatient surgery. This could mean significant difference of thousands upon thousands of dollars for both you and the employer. There is also a terminology in the healthcare field called a facility fee. Hospital-based labs and hospital facilities all charge a facility fee now, i.e. it's simply a fee to use their facility. And that facility fee can be as high as 30+% of a total claim. Enormous. There are also several other disruptive models out there, but again, consumers and employers must be very well versed and educated on how to use those models, or else it will come with a lot of employee and provider backlash. For example, reference-based pricing comes to mind. While RBP is no longer a new concept, it still comes with a lot of education as well as limitations. Wow, there's a lot here, understand, and it's a ton of stuff to digest. How could we advise an employer on pursuing? It's a great question that we hear a lot. Call us. We would welcome the opportunity to talk through all these topics with you. Healthcare is getting more complex every day, and we want our members to know that we're here for them. It all starts with a simple conversation and goes from there. We're also going to do a lot more of these podcasts. The intent is to fully educate our membership and make them aware of new trends, issues, etc. in the market. We want to keep them short, simple, and brief. If it piques your interest or you have questions, again, please contact us directly to discuss anything in further detail. Thank you for your time. Have a great day.